Sonadol Extra imetengenezwa kwa njia spesheli kupambana haraka na maumivu ya kichwa, mwili na hata meno. Sonadol Extra, hakika maumivu yakizidi, pata ushauri wa daktari.
When you're facing stubborn stains, you're always in a fierce fight. Clean Soft kicks out stains. Kimateki.
There's no debate. Home is best. If you must pay for deliveries, use your NCBA debit card. Stay home. Stay safe.
COVID-19 is here, COVID-19 is real, and COVID-19 has no cure.
Tafadhali angalia kitu inaitwa social distancing.
Jitenge na watu.
At least 2 meters away from everyone.
Let's just keep that distance.
Ikiwezekana zaidi ukufanyie kazi yako nyumbani kama vile tunafanya.
We can fight this together.
Tiba ni wewe, tiba ni mimi, tiba ni sisi wote. Come on Kenyans, let's do this.
This is NTV.
A very warm welcome. Thank you so much for joining us in this news broadcast. This is NTV at 1. My name is Dennis Okari, and we start off with our top story where both open air and closed markets here in the capital city are still operating, albeit under strict adherence to the directive issued by the Ministry of Health. Sathalala is going round the shopping centers to establish whether traders are observing the guidelines. Seth, where are you right now, and is the law being adhered to?
Well, good afternoon, Dennis Okari. I'm actually at Kenyatta Market, one of the capital's oldest open and closed markets, and this is a host to over 5,000 traders. We're talking about the famous Kenyatta Market, just located near the Ngumo estate, and it is here where business has been booming for the couple of previous years until the start of confirmed cases involving COVID-19, which has actually impacted businesses here negatively. And just shortly, I will be speaking to the chairman of this particular market. And like I mentioned earlier, Dennis, this is Kenyatta Market. It was established, or rather built in 1980. It hosts over 5,000 traders. We have different stalls over here. We have those that do the Jokali sector just outside, talk about the key cutting. We also have a number of stalls. Some of them, of course, are butcheries. We also have salon. By the way, this particular market, Kenyatta Market, is famous for the salons around this particular place and also the beauty shops. And what you're seeing here is that people, the traders who have been here, just trying to make sure that they earn that little sense, even as they're being impacted heavily by the COVID-19, that they also observe the measures and the guidelines that have been put in place by the Ministry of Health. We're talking about sanitizing, we're talking about hand washing, as well as social distancing. And now this is being undertaken by one of the organizations. It's called SHOFCO. It's a community-based organization. This is in a partnership with the leadership of Kenyatta Market, and this is mandatory to all the customers who are entering at Kenyatta Market to get particular services or even buy goods at this particular point. And like I told you, Dennis and my viewers, is that I was going to engage the chairman of Kenyatta Market, who joins me right now. But first of all, just put your mask on so that I can engage you. And of course, I'm observing my social distance over here. And Eric, you have to watch out because I nearly fell over there. But now, on a serious note, you know, we're talking about the measures being in place and the measures that have been put by the Ministry of Health. As a market, are you observing them? Because you're still operational, and this particular area has over 5,000 traders, which automatically is, you know, a public area, and a lot of people come here, both traders and customers. Are you observing the rules set by the government?
Yeah, first of all, thank you so much for coming here to interview us. My name's Mr. Moses Wenani. I'm the chairman of Kenyatta Market. And as you've just asked, coronavirus, by the way, is a very serious pandemic. And when we heard that it's actually killing people all over the world, immediately we moved in to start complying with the government directives on what to do to keep the virus at bay.
What are you doing? Because you don't have much time.
Yeah, we put about 15 sinks in the market, and we are very lucky because we have a borehole here. So we actually piped water across the market, and we put so many washing areas whereby when people come into the market, it is compulsory that you wash your hands before you come inside the market. So we've also put quite some sanitizers across the market. We've actually tried to make sure that people keep social distancing, and we have actually instructed one of our own with a public address system to walk around to sensitize people on the dangers of coronavirus.
And you have butcheries that sell namachoma, and you also have restaurants that usually operate. In terms of having to only offer takeaway services in terms of food stuff, are they adhering to this?
They are very cooperative, and they are very much cooperative. They are actually adhering to the instructions. Because the first thing we did, we removed all the seats from the butcheries, and we made sure that we instructed them that anybody who needs those services, they can only access takeaway services. So we don't encourage anybody to sit around to, eat anything. And in fact, hotels, we have closed them down, but we have only left butcheries which can offer only takeaway services.
Before COVID-19 cases were first, confirmed in the country, this particular place used to be jammed. Customers used to flock this particular area, but we've spotted some even empty parking slots, meaning that business is on the low. Is it affecting your income as well as traders?
Traders are really affected, and most of the traders here in Kenyatta Market are low-income earners. And in fact, at this particular point, I want to urge the government to ensure that at least it waives the rent on most of the customers here, because they cannot afford rent. Customers are not coming in. People are not doing business as usual. The incomes are very low. And as I told you earlier on, most of the people here are low-income earners. And so now that the coronavirus has affected them, it becomes a very big problem for them to afford earning an income.
Okay. And we hope that that income will resume being what it used to be here at Kenyatta Market, which, like I told you, established in 1980, hosting over 5,000 traders. But according to the chairman, business has been on the low. And this is just because of the measurements, or rather the adherence for many members of the public choosing rather to stay at home. Not many people are shopping as they used to. And we also have this particular official. We're not sure if he's a staff of this particular market or a member of the Ministry of Health who's just, giving that announcement. He usually does this on a regular basis just to make sure that everyone adheres to the measurements put in place. We're talking about sanitization, and we're talking about maintaining hygiene by hand washing, sanitization, as as well as social distancing. But they are hoping that this situation will not remain as it is, but it will actually come to an end as soon as the government and everyone collectively contains this particular pandemic that has already caused a negative effect here at Kenyatta Market. Dennis.
Well, very many thanks, Setholale. Be safe even as you grab your plate of ugali and nyama choma there. I'm sure you're enjoying that. Now, today enters the second day of mass testing for COVID-19 at the port of Mombasa, as the screening exercise also kicks off in Kilifi County. Kevin Mutai joins us with the very latest from Mombasa. Kevin, have you first of all been tested?
Well, of course, Okari, we're expecting that to happen, but I believe that we're good. Remember yesterday, the county government of Kilifi announced that they will kick off the screening exercise, and journalists among the people who will be prioritized. So we're expecting to see such kind of a move brought here in Mombasa County. But what we are learning right now is that the screening exercise at the port of Mombasa is yet to begin, because we are being informed that the health authorities have not yet arrived at the port. But what we know is that more than 150 staff members working at the parastatal were yesterday tested, out of which 42 turned out negative for COVID-19. And what we understand also is that they're expecting more results today and tomorrow. Remember, this exercise targets over 7,500 employees at the parastatal, and this comes after the government deployed over 1,000 testing kits to be used at the parastatal, and this was based on the risk of infections, because even the management of the Kenya Ports Authority prioritized key areas at the facility, because they are saying that the conventional cargo handlers and security officers are the ones who are being prioritized for this particular exercise. But they are doing it in a manner to which they can manage quite a good number per day. But we also understand that there could be some challenges, and that is why even the health authorities have not yet even arrived as of now, because I think that we are informed that they might be sorting out some logistical issues. And the same applies in Kilifi. Yesterday, the county government, the governor Amason Kingi, announced that they were going to kick off with the exercise today on Monday. But as of now, nothing has started. But we understand that KEMRI, that is the Kenya Medical Research Institute, was supposed to handle that particular screening exercise. But we are informed that they don't have some of the equipment to conduct screening, such as swabs, to collect samples. They only have the tubes, and we're told that they're waiting for all the necessary equipment so that they begin the screening exercise. And like I said earlier, the county government has categorized some of the key people who are being prioritized for the testing, Okari, and the law enforcement, that is the police officers, the local administration officers, those are the chiefs and their assistants, and of course also the health authorities are also a part of the exercise that are supposed to begin today, not even forgetting the scribes, because this is with regards, remember, the county government of Kilifi confirmed 10 cases for COVID-19, and this is in the effort of trying to curb further spread of the virus. But of course also, Okari, there is something that is raising concerns here in the coast region. Remember the three counties from the coastal strip, that is Kwale, Mombasa and Kilifi. The government mapped out these regions as hotspots for COVID-19. This is after several cases of infected person. Yesterday we got a confirmation from the Ministry of Health saying that Mombasa leads with the most majority of people infected with the virus, Nyali to be specific, leading with 11 people infected with coronavirus, followed by Kisauni and Vita with 7. And of course also we have even people in places like Bamburi. There are people there who are infected with COVID-19, but there are discrepancies in terms of numbers of current, because remember on the 14th of this month, the Ministry of Health said that the Mombasa County government had confirmed 34 cases for COVID-19, and the numbers have been increasing. Even reports from the local media houses that have been tallying these particular numbers. Mombasa currently is supposed to have 48, and the government, according to the statistics that were released yesterday by the government, the numbers could have even hardly reach 40. So these are some of the questions that we are raising to the Ministry of Health to get an understanding of the correct figures in terms of the numbers of people who have been infected with the pandemic, the deadly disease, but of course also highlighting that this mass testing was focused on the port of Mombasa after the parastatal confirmed 7 people to have been tested positive for coronavirus, with at least 2 people losing their lives to the virus. So Okari, we are still sampling different stories from the key stakeholders in charge of the controlling the spread of the virus from across the region, and we'll have a very detailed and story in our subsequent bulletins at 7 and 9 o'clock. Back to you, Okari.
Thank you very, very much, Kevin. Apologies there for the strong winds knocking Kevin's microphone. And speaking of scribes, Kilifi journalists are among the first people who will be tested for COVID-19 as the county begins mass testing today. This is according to Governor Amason Kingi. Speaking at his office, Kingi said that journalists will be given priority since they come into contact with anyone and everyone in the society and hence were at a high risk of contracting the virus. The governor added that healthcare providers, security officers and senior administrative officials in the national and county governments will be tested in a continuous exercise that will culminate with all residents being tested. The procedures in conjunction with the Kenya Medical Research in a bid to know the extent of the spread of the COVID-19 virus within the county. The governor also said that 17 people who were arrested at a palm wine den drinking will be forcefully quarantined at the Kenya Medical Training College premises in Kilifi town at their own cost. Among those arrested were 2 police officers, and they tried to resist by hurling stones towards security officers, forcing them to shoot in the air.
200 kwa sasa, na kati ya wale tumepata visa 6. Kwa hivyo tunataka tujue, je, vile visa 6 ni vile peke yake ama kuna wengine pale kule nje ambao pengine hawajaonyesha dalili. Ndio maana tutaanza zoezi hili hapo kesho, na tutaanza zoezi hili kupima wafanyikazi katika idara ya afya, our health workers.
The Kenya Medical Practitioners, Pharmacists and Dentist Board says a number of health workers have undergone testing for COVID-19, but they are yet to receive their results 1 week down the line. They want the results to be availed 48 hours after one has been tested. At the same time, they have cautioned county governments against harassing health workers. According to them, Kirinyaga, Laikipia, Taita Taveta and Kwale counties have been threatening doctors on study leave that they would not receive their salaries.
We don't want a situation where we have bora PPEs. Tunahitaji PPE bora. You've had cases where everyone is testing with lives. We've had substandard personal protective equipment. We urge the relevant authorities, including KEBS, to come in and ensure that we have quality PPEs. If a healthcare worker cannot get N95 mask, if you cannot get face shield, if you cannot get a surgical gown, if you cannot get a shoe cover, then surely that is not the environment for you to work in.
We propose 1, consideration of a waiver of the pay for a period of 12 months. 2, a emergency COVID risk allowance payable to health workers. And 3, that all healthcare workers in the national governments and the county governments be enrolled under the comprehensive NHIF civil servant scheme for insurance and treatment during this time and beyond this time. And then further to this, for compensation of healthcare workers, as we have seen across the world, which is unfortunate, but it's also a reality, that healthcare workers have become casualties on the front line. So our proposal for compensation to cushion the families in case of any eventuality is the creation of an occupational disease fund as a subsidiary legislation of the PFM Act under the WIBA Act 2007.
The Nairobi hospital has reopened 3 of its major outpatient centers in the capital due to the public's request to easily access medical services. Normal clinic services are the Galleria Mall Outpatient, Warwick Outpatient Center and Capital Center Outpatient have resumed services from Monday to Sunday at 7 a.m. to 4 p.m. daily. In addition, consultant clinics at the main hospital have been permitted to resume functioning at the discretion of respective consultants. The main hospital has been conducting mandatory temperature screening and travel history checks at its entrances in a bid to detect symptomatic scenarios associated with COVID-19. The Board of Rural Electrification and Renewable Energy Corporation has forfeited its allowances during this time when the country is fighting the coronavirus pandemic. The corporation chairman Simon Gisharu says the board had decided to make that as its contribution to the national COVID-19 emergency kitty. This will include their monthly honorarium and their sitting allowances, and the agency has so far collected 110,000 shillings surrendered by the board members and an additional 100,000 shillings from Gisharu's personal account. Gisharu says in the course of implementing the mandate in rural electrification and renewable energy, their staff have been coming into contact with the needy and hopes their contribution in a small way towards the kitty will ensure such Kenyans don't sleep hungry. A footbridge link connecting 2 slums in Kitale town, Trans Nzoia County, has been destroyed by flash floods due to the ongoing heavy downpour in most parts of the country. More than 50,000 people from the informal settlements of Tuwan and Mitume have been left stranded without basic services following the destruction. Judith Cherono reports.
Residents have accused the county government of Trans Nzoia of neglecting the region despite being home to half of Kitale's population. The contractor who built the bridge has not been spared either, with locals claiming that he did a shoddy job.
Viongozi wa Trans Nzoia kuanzia kwa MCA wetu wapa Daddy Wambwa. This one's a serious issue within Tiwani. Kwa sababu hata daraja yenyewe iliundwa na matope. So hata hivi japata mtu angekufa hapa.
Hata hii daraja inanisaidia mimi mwenyewe wakati wana raise alarm, ni rahisi kuruka na afisasi wangu nifikie mahali ambapo janga limetokezea za upotofu wa usalama.
Speaking to journalists, the area chief said a destruction of the water sources near the footbridge could greatly hamper the fight against the spread of coronavirus due to lack of water.
I'm appealing to the county government waharakisha sana fund this project ili waweze kujenga hii daraja very soon.
The Department of Public Works says it has already sent engineers to evaluate the magnitude of destruction and give recommendations. Judith Cherono, NTV.
The Board of Directors of the Nation Media Group has proposed a bonus share issue of 1 share for every 10 held to shareholders on the register as at the close of business on 12th June 2020. The move is subject to approval by the Capital Markets Authority, the Nairobi Securities Exchange, and shareholders of the company. The announcement comes after the firm posted a 23.4% decline in net profitability to 856 million shillings for 2019, attributable to a challenging economic environment. Turnover during the 12-month period declined by 6.3% to 9.1 billion shillings, while total comprehensive income dipped by 18.4% to 862.6 million shillings. In light of the need to invest in digital media, the directors of the company do not recommend a final dividend, meaning that the interim dividend of 1 shilling and 50 cents paid on 30th September 2019 will be deemed as the final dividend for the year. Due to the prevailing restrictions on mass gatherings, arrangements regarding the annual general meeting will be communicated to shareholders at a later date. Well, time now for a short break. I'll be back with more stories. Stay with us.
Maritime tips brought to you by Kenya Maritime Authority. Precautions for vessel and boat owners, operators, coxswains and passengers. Personal hygiene. Practice frequent hand hygiene, coughing and sneezing etiquette. Clean and disinfect frequently touched objects and surfaces on board the boats and vessels such as steering wheel, safety or guardrails and seats. Crew members, coxswains and passengers to regularly disinfect life jackets. Practice frequent hand washing with soap. Wear a mask on board a boat or vessel. Boat owners and operators to comply with government directives on movement restrictions within counties. Kenya Maritime Authority for safe and efficient water transport.
Discovered the world-famous Molfix and saw the difference. Let's see how absorbent Molfix is.
Molfix, thanks to its ultra-absorbent particles, can keep more liquid than the other diaper brand, so you can use it comfortably all day long.
All babies deserve a high-quality diaper. You should also try Molfix.
Welcome back. Sugarcane farmers from Western Kenya have raised concerns over alleged dumping of illegal sugar imports from neighboring Uganda, a situation that is threatening to kill the already crippled local sugar industry. Stakeholders in the industry that include millers and members of the Sugar Task Force now want Agriculture Cabinet Secretary to intervene.
The influx of unlicensed sugar smuggled into the country by unscrupulous businessmen was first spotted in Bungoma County a week before the government released custom import licenses for importation of the commodity last Friday. Some of the sugar has reportedly been repackaged into Kakira and Lugazi Sugar Company bags. Farmers from the affected Nzoia, Butali and West Kenya sugar growing zones are outraged by the illegal imports.
If you bring in sugar from elsewhere, you should know that you are not going to be able to pay your own farmers. You are paying farmers elsewhere.
Nzoia, Miwani, Mohoroni, etc. are already owing farmers arrears.
We are struggling to build up funds to pay the farmers. More particularly, we are talking about the government institutions, which must be protected.
The moment the sugar comes from outside, the prices go down. And once the prices go down, then it has a very negative impact on the farmers.
Farmers, sugar millers and local traders have reported that sugar which started trickling into the country early last week are in various stores situated in Bungoma, Misihu, Kitale and Cherengani. The Agriculture and Food Authority, AFA, is now urgently being called upon to move in and protect Kenya's economy from adverse effects of unregulated cheap imports.
Before the sugar importation imefanyika, they consult the millers wajue deficit ni gani, so that the millers can advise and import kulingana na vile shortfall iko.
Bungoma Governor Wycliffe Wangamati, who is also a member of the Sugar Task Force, cautioned that opening up the import window could have negative impacts as the prices could fall to unprecedented levels.
The Cabinet Secretary in charge of Minister of Agriculture, Mheshimiwa Munya, to come out and explain to us why this has happened, because we need to understand as opinion leaders, we need to understand as leaders from this region.
The Agriculture and Food Authority, AFA, and the Sugar Directorate are yet to respond to the farmers and millers' concerns in Western Kenya. Seth Olale, NTV.
A 10-day door-to-door awareness campaign to reduce rural infections has been kicked off in Marsabit County, aimed at educating herders in the north as cases of rural infection continues to rise. Stakeholders, mostly non-state actors, are spearheading the campaign, which seems to curb further spread of the disease in Marsabit.
As the world struggles with COVID-19 pandemic, herders in the north who trek in search of pasture for their livestock are still living in the dark.
We do not have proper information on the COVID-19 pandemic.
although we heard of the spread of the disease on local radios. We are yet to access proper information on the spread of the disease. All we want is better access to information on how to prevent the spread. As a village, we barely know the signs of COVID-19 because we are less informed. We want to be taught, all of us, because some of us are in the remote areas.
Stakeholders have now embarked on a door-to-door awareness campaign among the pastoralist community in Marsabit County. Pastoralist Community Initiative and Development (PASIDA) and various non-state actors officially launched the awareness campaign, which will cater for the rural population in the county.
We really wanted to do a serious campaign reaching to the remotest part of this county, areas like Badarero, Ambalo, Ileret, Garwole, Gas, Moite, Sarima, and other far-flung areas, because we strongly feel that our pastoralist communities are moving from place to place and they do not really have access to means of communication. So basically, we really felt that it's good for us to really move out of our way to reach out to these communities with the information. And we've just dispatched 6 vehicles mounted with the public address systems so that we're able to deliver this information in the local language.
Our people here, where we are serving in Marsabit County, people are pastoralists, people who cannot access information. Therefore, as PASIDA, we are here to reach the most vulnerable people who have no information about this problem. Already with their cultural, traditional system of setup, still it is hard to convince them, but now we are going down mashinani to ensure that this information reaches to these people and God forbid, they will be safe from all fronts.
Meanwhile, the Marsabit County government is considering a ban on movement in and out of the county following an influx of travelers from major urban centers. Marsabit County has also shut its borders with Ethiopia and Mandera County following 6 confirmed positive cases.
Kama hiyo ni tisho kubwa na tukidhibitisha maneno hiyo ni kweli, hatutasita kuchukua hiyo hatua. Hatutasita kamwe kuhakikisha ya kwamba watu wetu wako salama, na kama hiyo hatua ndio itasaidia tutaifanya mara moja, lakini bado tutajadiliana.
Mamo Ali, NTV, Marsabit.
And farther afield, a sense of death stalking the hospital ward, fear of dying alone, tearful despair and disarray at home, solitude, anger, and the desire to share or change their life. Several people in the United States of America who have survived COVID-19 share emotional and harrowing stories of the pain and fear after catching the virus.
So I went to bed and I stayed in bed for 3 days until the fever broke, and then I waited 24 hours to make sure I was kind of clear. And then I felt fine. I went back to work and I worked over that weekend and a couple of days the next week, and I felt fine. And then suddenly on the Wednesday, I just collapsed really, and I had to be taken into hospital. And after, I don't know, 12 hours or so, they did the test, and much to my surprise, I had the virus. Because I was sick, and then I got better, and then I kind of got worse again, and I got better again, and we were all set to go home, and then the doctors suddenly said, there's something not quite right about the numbers, and we can't let you go yet. And so it was a bit up and down.
The first days when I had a mild fever, I had the stomach problems, I had the loss of taste and smell, and I had the chills. It was not fun. I'm not gonna lie, it was not fun, and especially I was by myself. But on day 8, my fever spiked to 102.7, and I started with the cough, the dreaded cough, which I had not had, and I thought I was gonna be one of those lucky ones that didn't get it. It hurt so much inside my chest that I could not use my inhaler because I couldn't take a deep enough breath.
With other symptoms like the dry cough, fever, I was lethargic. I could barely breathe. I got the shortness of breath. And so then I went to a testing center. I got tested. And then I found out I tested positive, and it's just kind of been a roller coaster ever since. So the treatment that I received was for the respiratory infection. So I was given azithromycin, I was given prednisone, and I was given a bronchodilator and Bromfed, which is a cough syrup.
And when I got up that morning to go to work and I'm taking my shower and I couldn't smell my shower gel. And I'm like, this is kind of interesting because I need this little wake up boost. So it was going to be a busy day. So I kind of rushed out the house, packed my breakfast in my lunch bag, got to work, did a little morning thing, and went to drink my tea, and I couldn't taste the tea. And I said, this is not okay. My worst symptoms were just not being able to taste my food and to enjoy my food. That has since been resolved, and I'm back to eating probably more than I would before that, but that's gone.
Time now for sports, and here locally, national volleyball team captain Mercy Moim has called on the Kenyan government to extend sports the same way they extend support it has been giving to other sectors as a result of the coronavirus pandemic. President Uhuru Kenyatta directed the Ministry of Sports, Culture and Heritage to direct 100 million shillings from the sports fund to cushion local artists from effects of COVID-19, while ironically leaving out the sports industry, which is one of the hardest hit.
Kuna players wale wako national team na wako players hawana contract, so mimi ningeomba tu the government wasaidie, kwa sababu mtu volleyball ndio life yake yote, na saizi vile kila kitu imesimama, ana mbele ana wala nyuma, na ndakana alipa hao, ndakana food, wengine wako na family. So mimi ningeomba government na Olympic committee waingilie kati, wasaidie volleyball swala hawana contract. The sports people, mimi nataka tu hivi tukue tu kitu kimoja. Tuseme mwenzako ana anything, wewe uko na contract, mwenzako hana place ya kupata food, tabiti tu msaidie.
Well, couldn't agree more. A Japanese expert who criticized the country's response to the coronavirus has warned that he is pessimistic, in quotes, that the postponed Olympics can be held even in 2021. Japan and the International Olympic Committee agreed last month to delay the Tokyo 2020 Games until July 2021, following pressure from athletes and sports federations. Kentaro Iwata is a professor of infectious diseases at Kobe University.
Japan might be able to control this disease by next summer, and I wish we could, but I don't think that would happen everywhere on Earth. So in this regard, I'm very pessimistic about holding Olympic Games in next summer, unless you hold Olympic Games in a totally different structures, such as no audience or very limited participations.
Well, Roma chief executive has praised his players' superb gesture after they volunteered to forgo 4 months' salary to help the club during the coronavirus pandemic. The players' manager, Paulo Fonseca, and his staff will also pay the difference to ensure all club staff placed on furlough receive their full salary. Led by Captain Edin Yako, the team and Fonseca approach Roma's hierarchy. Roma have not played since the first match, just days before the Serie A season was postponed. Italy currently has the highest death toll from coronavirus in Europe, with more than 23,000 confirmed deaths. Well, that's all we had for you in this edition of NTV at 1. My name is Dennis Okari. We'll have our subsequent bulletins at 4, 7 and 9. You don't want to miss. And obviously waiting for the update that comes from the Minister of Health by Cabinet Secretary Mutahi Kagwe. We'll be looking forward to that and looking at if the numbers have increased dramatically or what currently is happening. In the meantime, enjoy the rest of your viewing. Have a great afternoon.